Listen to Outbreak Alabama, Stories from a Pandemic, above. Today, we hear from Dr. Michael Saag, Director of the Division of Infectious Disease at UAB. This show took a break, but the pandemic did not. It lingered, and now it's exploding again, due to low vaccination rates and the extremely contagious Delta variant that is running rampant through our state. After recently falling behind Mississippi in COVID vaccinations, Alabama remains last in the nation. Only a third of the state population is now fully vaccinated, according to the Centers for Disease Control and Prevention. AL.com reports vaccinations in Alabama have slowed to a near standstill, sitting under 5,000 doses administered per day. At the current pace, Alabama won't reach the Biden administration's summer goal of 70% of adults having at least one shot until well into 2022. Saag, who worked to educate the public about COVID-19 early during the pandemic, tested positive for the disease in March 2020. We cover a lot of ground, namely Alabama's vaccination rate, why people remain reluctant to get vaccinated, what people should know about the Delta variant, why there's nothing political about protecting yourself from a deadly virus, and how we are making the same mistakes we did when COVID was peaking by rushing back to normal life. In May of 2021, in the United States, 18,000 people died from COVID, 17,850 of those folks were not vaccinated. That 99.2%. In June, same story, 10,000 people died, 99.2% were not vaccinated. And among the people who were vaccinated and died, those individuals were mostly immunocompromised, meaning they had solid organ transplants where the immunity from the vaccine wasn't strong enough to protect them from progressive disease. For those who were unvaccinated, that have no pre-existing immunity, so they're totally vulnerable. This is a public health emergency right now, a true emergency. I know you're tired of hearing that, but that's what we're dealing with. And people with public health expertise would be derelict in our duties if we didn't sound the alarm. This is an emergency right now. The biggest difference between last summer and fall and now is that we can do something to prevent this, and that's get vaccinated. You get vaccinated, not only do you reduce your risk to a very low number. The Delta variant can break through a vaccinated person. About 25% of the people who have been vaccinated will get infected with the Delta variant, but the disease is a short duration of mild symptoms, and unless immunocompromised won't progress to severe disease. But for those people who are unvaccinated, not only are you putting yourself at risk, you're putting those people who have been vaccinated that are immunocompromised at risk. And that's, in my view, a tragedy because this is totally preventable. Those deaths in May, the deaths in June and the ones that are happening in July are totally preventable deaths.